I'm Dr. Dev Patel, and I'm going to give you a quick rundown on the what, how and why of the coronavirus and COVID-19, and I can hopefully bust some myths along the way. So what is coronavirus? Well, I should say coronavirus as this is actually a family of different viruses that can cause disease in animals. 7 viruses from this family, including the one responsible for the current pandemic, have made the jump from animals to humans. The virus is called SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. Bit of a mouthful. The disease it causes is called COVID-19, which just stands for Coronavirus Disease 2019. So how did it come about? Well, in December 2019, a number of cases of severe pneumonia began to appear in Wuhan, capital of Hubei province in China. This was tracked back and believed to come from the first or index case of a man who had eaten from a wholesale animal food market. The virus is believed to have come from a bat, but likely to have jumped to this human being via an intermediate host, possibly a snake. Finally, why has SARS-CoV-2 literally brought humanity to its knees in a matter of weeks? As the name of the virus suggests, it is genetically very similar to the virus that causes SARS. Now, you may remember the SARS outbreak, which started again in China, but this time in the Guangdong province in November 2002. Well, this ran well into 2003, infecting around 800 people, but killing almost 10% of those. So why did that virus not spread to the same degree? Well, the spectrum of disease was quite different. Most had severe symptoms, so could be identified easier and isolated quickly. In this case, with our current pandemic, although it can be reassuring that so many people infected with SARS-CoV-2 may have no symptoms at all, this has led to significantly more spread of the virus due to individuals unwittingly passing it on to others. Sadly, this has also been due to selfish behaviour or indifference amongst many, especially younger people, who may have a sense of feeling invincible to the virus and whose only focus in life is immediate self-interest. However, this has further compounded the rate of spread amongst the global population, affecting in particular those with coexisting health issues, older people, and frontline workers who are getting repeated exposure to the virus from the most severely affected and likely most infectious patients. I should add that there have actually been a number of deaths in the younger age groups in individuals who are understood to be previously fully fit, including a 19-year-old in the UK just this week. Another factor for the rapid rate of spread is the amount of travel we have nowadays. Even in the 17 years since the SARS outbreak, human movement has increased significantly. The virus is reminding us that we are one species living on one planet. Borders do not exist. Thank you for listening, and join me in part 2 for some myth busting on how you might catch this and what symptoms you may experience. Thank you, and please stay at home.